Hi, I'm Dr. Patel, and today I am with Lauren. She is a school teacher, and she loves to do HIIT workouts. So tell me a little bit more about these workouts and what you do.
It's kind of a combination of running and different weight exercises, body weight, different weights.
And it's high intense.
High intensity
45
interval.
minutes. Okay.
Yeah, 45 minutes to an hour.
Okay. And so you were telling me you were feeling a little bit of hip pain or IT band pain.
I was having more hip pain. I kind of have like a weird feeling behind my right knee, and I don't know if it's because I'm really tight here and then my lower back's just been a little bit off.
Okay.
But I had an injury from that years ago, so.
Yes, you told me about that. Okay, a little shift in the pelvis. So I'm going to start by doing an orthopedic exam and looking at your starting low back down. Actually, I'm going to start just by checking your neck to be safe.
Okay.
Look all the way down. Let me know if you feel any tension or discomfort. Okay, and all the way up. And look all the way up again. And all the way up. Any discomfort there?
No.
Okay. And you said you have a little bit of tension.
Mm-hmm.
Is that from the kids?
Mm-hmm. Every day.
Go ahead and kick both your legs out straight in front of you. Try to reach your toes.
While I'm sitting here?
Yeah.
Go
You
down.
you can scoot back a little bit. There you go. Try to reach them. Good. Any pain? Do you feel that pain in your hamstring?
No, just tightness, and it's more when I'm like running and pounding on it.
Okay, that's when you feel the pain behind your knee.
Mm-hmm.
Okay. Hug yourself. Oh, not that way. Drop your knee.
Oh, hug myself.
That was great.
My knees up and everything. Gotta be more specific with me.
Definitely you work with little kids. I'm gonna twist you. Let me know if that hurts your back or your pelvis.
No.
Okay. A little crack there.
Yeah.
No pain in your back there?
Mm-mm.
Okay. Go ahead, lie on your back, face up.
That direction I could follow.
Most people lie on their stomach when I tell them to lie on their back.
Oh, really?
Like 90% of the people. It's funny. When I press, do you feel any pain? Okay. And do you stretch after you work out?
I try.
Do you do like foam rolling or?
I was doing foam rolling more, but
Okay.
more just like sit on the floor and stretch.
Okay. Any pain there in the hip?
No, I just feel some tightness.
Okay. And your glute at the back of the hip? Okay. What about here?
No. Yeah, I feel like something in there.
Okay. And this is the side that you're feeling that
Yeah.
pain, right? Okay. Nothing here? Okay. Good. I'm gonna stand here, take this leg, hold it up, put your arms by your side on the table. Good. Hold your leg up here, hold strong, don't let me push down.
Okay.
Okay, good, not bad. And this one here, hold up, hold strong. Good. Let's try this one again. Turn it out a little bit, hold strong. Does that hurt?
No, this was where I had a.
That injury?
Mm-hmm.
Okay. Push your leg out towards the TV. Good. And this side, push it out. Good. And push in towards your opposite leg. Right here. Good. And your left side, push in. Good. Kick your leg up into my hand. And then pull your heel towards your butt. Any pain there?
No.
Pull your heel towards your butt. Any pain there?
No, I just feel like a little something in here.
Okay.
But that's like the front part of this.
Okay. Straighten out your knee. Good. Push down. You feel it in the back of your knee?
Only a little bit.
Okay. Have you had any knee injuries?
No, I only had a knee issue when the hip was bad because I was leaning into other sides, but
Okay. So when I go this way, you're fine, but this way you don't want to move.
yeah.
There should be a few more degrees. Alright, this is gonna be a little uncomfortable. I'm gonna check your adductors.
Okay.
So when you were seeing the other chiropractor, what were they doing? Just adjusting you?
Mhm.
No, like modalities. Okay. Were you doing exercises, or did they give you any exercises?
Yeah, they gave me a few.
Okay.
It was like more for tightening my lower back.
Okay. So you only feel it when you run?
Sometimes when I'm just walking too.
Okay.
And then every once in a while, like if I'm just sitting, I'll feel like a pulsing feeling
Okay.
behind there.
Is it sharp or like dull, throbby?
Throbby. Got some strong hands there. That right there, I feel more than in here.
Okay. And you always have tightness in
So what are you doing?
I'm doing active release to the quad, except I'm moving her leg because it's going to be a little bit painful.
This is like good pain though.
You don't bike, but you run, right?
Yeah.
Okay.
We bike in some of the classes, but
Okay.
for like short amounts of time.
And did you ever play soccer or other sports?
Tennis,
Tennis. Okay.
gymnastics, karate.
Okay. How long did you do karate?
Only like 3 years or so.
Was it when you were younger?
Yeah,
Okay.
but I still do like kickboxing and stuff now.
Okay. I'm just gonna use the Graston again. Does it hurt right there?
Yeah.
Yeah.
I kind of feel like that crinkling.
Yeah. See, I'm trying to go smooth and it just like gets a little
Yeah.
bumpy.
I can feel it.
Let me have you go on your side facing the TV.
I can watch the back. Yeah.
hurt right here?
Uh-huh. I don't know if that's normal, but I can like feel stuff in here too when you're doing that.
Okay. Sometimes when you have an injury like that you've had for a long time, the nerves can be a little bit more sensitive.
Oh, okay.
So you'll feel it along the whole muscle. But I feel like this muscle...
Yeah, because right when you're doing that, I can feel it right in here.
Okay. Yeah, I feel like you have a lot of adhesions, and I feel like this has been tight and just getting tighter since you hurt your pelvis the first time. Okay, I'm going to do a little bit of dry needling around that IT band. So this is the IT band here, and all around this whole area, that's the quad. Alright, and Lauren's had acupuncture before, but today we're going to do dry needling. So I'm using 1-inch needles. So just so I don't scare her, I'm actually going to start not in that region where she feels the pain, but a little bit around it, and just feel around the quad. So that one's okay. That one is okay. That one might hurt a little bit.
Yeah. Oh, yeah.
There it is. You'll see that twitch. That's usually when the muscle kind of grabs the needle. I'm just going to check higher up. Do any of them hurt?
No, just that one.
Okay. Ah! Don't get that. Hold on. Put that away. Does this one hurt?
Yeah.
sit for a little bit. Okay, turn on your side and face me.
Oh,
I'm calling you. Your mom. Bring your hips closer. You're good. Straighten out that body line. Perfect. And that's because you do this every morning?
it just happens.
Nice.
Nice.
Let me get you face down.
Hands down.
Yeah, just drop your shoulders all the way down. And lift your head up and drop towards me. Good. And lift your head up and drop.
Ooh.
Nice. Okay. You can come on up. Again, so we're going to test it. Reach your toes. So in the beginning, compared to now, how much do you feel it around that right knee?
I don't feel it around the right knee. Just like I just feel like you worked on it, but not
Okay.
no pain.
Okay, good.